Well, nowadays, when we talk about hospitals, the conversation typically has to do with COVID-19 solely, but there are other important issues at play. And joining me now are two people to tell us more about it. We have Dr. Brandon Bruns. He is the Associate Professor of Surgery at the University of Maryland School of Medicine and Chief of Trauma at Prince George's Hospital Center. We also have Beatrice Brathwaite. She is Senior Injury Prevention Coordinator, Pediatric Trauma and Burn Program at Johns Hopkins Children's Center. Thank you so much for being with us, you two.
Thanks
for having us.
So I know that you both work as part of TraumaNet. Tell us a little bit more about what that is.
TraumaNet is a Maryland statewide organization. It focuses on trauma advocacy and awareness for the population. We engage in injury prevention, education, and activities such as Stop the Bleed and other initiatives.
And May is Trauma Awareness Month. What is that all about, and how is your organization how is it getting involved to alert the public about that?
Yes, even though many Marylanders are staying home and trying to keep off the roads, we know that unintentional injuries are still happening every day. TraumaNet's Trauma Awareness Month is just to remind people of that, how to stay safe, and then also to give thanks to the responders and the healthcare providers that help keep these people safe and allow them to live their lives again.
Absolutely, because just because the pandemic happened didn't mean that other accidents were, they stopped in their tracks. These things happen as well. So what are some of the general injury prevention tips that we as viewers can do at home just to make sure that we are not getting injured?
Yes, from the pediatric aspect, we just want to make sure that we are encouraging active supervision. There are a lot of children at home who are bored and curious. So just using those safety products that you've had, dusting them off and actually putting them to use as well to help give you that extra feeling of security for your children. You also want to make sure that you are providing a safe environment inside the home and outside of the home, encouraging those bike helmets with every ride, making sure you are putting your medicines and cleaning products up high and away so that we can reduce the risk of children getting access to those things.
All right. And for our adults, because we can be a little clumsy sometimes, we're all in the house together. So any tips for them?
I tell you, what comes to mind is using alcohol responsibly, whether it be drinking and driving, drinking and boating, drinking and walking. You would be surprised how many injuries are related directly to drugs and alcohol and the abuse of those substances. So just exercising caution. Do not drink and drive a car. Do not text and drive a car. Do not drink and drive a boat. Just exercise caution.
Being cautious. Absolutely. I think my thinking immediately thought of people wanting to do things around the house. They get up on the roof or they're trying to fix a deck and they're just not necessarily paying attention or sort of taking their safety for granted. But you're right, that is an added component. I'm also wondering, it seems like many people have been avoiding hospitals because of COVID-19. Do they still need to do that in the event that there is an actual injury?
Absolutely not. I will tell you, we are taking extreme precautions in all hospitals and trauma centers throughout Maryland to ensure patient safety whenever you do come to the hospital. I would suggest whenever you come, wear a mask, wash your hands, don't touch your face, all the things that we've been hearing. But a hospital is still a safe place to come, especially if you're having symptoms of trauma, chest pain, stroke, etc.
Right. That's not anything you want to ignore just because you're scared of, going into an environment where COVID-19 may or may not be. It could be anywhere. Where can people get more information about TraumaNet?
Our website, I had to glance, is maryland-traumanet.com. And on there, you can find links to injury prevention videos and other educational components aimed at the public and to alert everybody about Trauma Awareness Month, et cetera.
All right, Beatrice and Brian, thank you so much for being with us. Really appreciate it. And we'll be right back with more Midday Maryland right after this. Stay tuned.
Thanks.